have on Dr. Shawn Baker MD, not the originator of carnivore, but you named it. You named the diet, the Carnivore Diet, right?
Yeah, I put the name on it, but certainly there's been people practicing this for, physicians even going back to the 1700s in Scotland. I mean, we've got records of that. And then obviously humans have been doing this stuff for, thousands of years. So I by no means invented eating meat, or even exclusively. I did put the name on, and the name kind of has been, I guess it's been catchy or controversial. So it's kind of helped propel it into, more of the main, I guess more people have noticed it, and most people hate it, but it's getting some recognition,
So when I first heard the Carnivore Diet, I said, well, this is just the natural reaction to all these vegans doing what they do. And people are just pushing back. And then I heard your podcast on the Joe Rogan on the Joe Rogan podcast. I heard that episode, and what you said started making a little bit of sense to me. And at first I'm like, man, this guy's out of his mind. But you were backing everything up that you said. There was nothing that you said that was illogical. Everything kind of added up. So then I started dialing into it a little bit more. And then I heard you talking about 100-day, I think it was 100-day study of people that did carnivore straight for 100 days. So I did that. And Doc, I got to tell you, I felt awesome. I had tons of energy. I went from 205 to 185. But the two things that happened, one, my body odor it became brutal. I have no idea why. And my thought process was, maybe it's because I wasn't having any soluble fiber. And it might have had to do with my LDLs and lack of soluble fiber. That could have had to do something with it. I don't know. And then the other thing that happened was when I broke my carnivore diet, I started eating little things here and there. Like I had some walnuts. And the amount of pain that I was in just from eating walnuts, where I've had like a slight walnut allergy before where it was causing itching. But then afterwards, I was bent over in pain for probably 4 hours. It was brutal. I had to drink a ton of water, try to flush it out of my system. It was almost like an anaphylactic reaction. So it made me think that the straight elimination diet, the difference between eliminating all stressors versus slow inoculation, right? Like that thought process on it. What are your thoughts on all that?
Yeah, I mean, that's some interesting topics. And so, you're sort of, the feeling good, losing weight. I mean, that's pretty common. We see that pretty typically, and I don't know what your diet was before, but if your diet was what most people eat, getting rid of any of that junk is always going to be helpful. And I mean, as far as body odor, I mean, that's pretty atypical. I mean, it might've been, being in heavy ketosis initially, you might have had some of that going on. That tends to sort of subside over time. But as far as, an elimination diet, this has been very effective for a lot of conditions, and the reason I'm into it as a physician, I want to see people's health improve. If they look good in a swimsuit or, can lift more weights, that's great too. But I mean, the ultimate reason, and, we have a company that we founded around this called Revero. And one of the things we look at is, what diseases are you dealing with? What are your individual demographics? Are you an old guy, a young guy? Are you active? Are you not active? Are you sedentary? What's your job like? Or what's your sun exposure? All these different variables that we put in. What's your ethnicity? And we are able to see patterns where some people, I think carnivore is kind of a baseline elimination diet, but to be fair, not everybody wants to do that over the long haul. I mean, people are like, hey, I'd like to have, I can appreciate eating meat and I like eating meat, but I don't know that I want to do that 100% exclusive for the rest of my life. And so what we're figuring out, and we're using some AI stuff to figure out these patterns. We can see that someone with psoriasis will have a limited palette of foods they can eat outside of meat that are relatively safe. And then we can start to customize and tailor these particular situations. And they change with time. You have to remember, like I said, we have a lot of people, diabetes, honestly, type 2 diabetes is really easy to treat and easy to reverse. And so you get people, they start out, maybe obese, insulin resistant, pre-diabetic, diabetic, whatever the situation is, and you put them on a diet, and then as you fix all those things, and they're no longer obese, and they no longer have maybe perhaps certain digestive issues, and they no longer have blood glucose issues, their diet can evolve from time. And I think that's a good point. Like I said, while I'm a proponent of meat-based diets, I think meat is an incredibly important health food. I think carnivore diet is awesome, and it works well for people. And there's people that have been doing it strictly for literally 10, 15, 20. In fact, the Harvard study that just came out, the longest participant had been doing it for 28 years. And so it's certainly sustainable for the people who want to do that. Is it necessary for everybody? I would say no. It may be necessary for some people for sure, but I think there's some sort of, I'm not very dogmatic about this, even though I've been accused of, you're a zealot and you think carbs are bad. And I've never actually publicly stated that. I just think that for some people, certain foods cause problems. And in some cases, those are crazy enough vegetables. For some people, broccoli doesn't work. And I think that's just something we have to recognize and not just be adherent to, God damn it, fruits and vegetables are a wonderful thing in the world, and you need to eat 6 buckets of them a day, every day, all people in all situations, when it's just clearly it's not borne out in reality. So yes, I mean, the short answer is yes. I think it's fine to find out what your tolerances are and enjoy life. And if it means you can eat meat plus fruits and vegetables or whatever, that's fine. I mean, unlikely you're not like what's behind you, the Beyond sausage crap. I mean, I don't think humans are designed to eat that. And I think probably, 80% of the offerings in the grocery store, humans really aren't well designed to deal with. And so that's really the biggest problem. Now, what's left is, you got to, I mean, if we were just to back the clock up, 150, 200 years, and you're in New Jersey and Alex is in Switzerland, and you would try to eat food that occurs naturally, that doesn't come from South America or Brazil or Africa, or it has just been imported, you're going to have a very limited palate. I mean, you only have the ability to eat, maybe a dozen or 25 foods, and most of it's going to be, particularly in the wintertime, good luck finding mangoes and bananas. I mean, you're just not going to find them. So I think that's, if you just go back to that, I mean, it makes pretty good sense.
What about for disease-free people? And have you found like any kind of performance benefits? Because I mean, you're a pretty stud athlete yourself, right? I mean, are you doing all of these feats purely with carnivore backing you up?
Yeah, I mean, it's been something that, I think, and particularly, I think athletes, particularly as you get older, I mean, I think that's just the bottom line. I think you just start to become less tolerant to things you could have handled maybe in your 20s. And so I'm seeing a lot of athletes now, particularly in sports like mixed martial arts, Brazilian jiu-jitsu, weightlifting, even ultra distance runners, triathletes, 100-mile marathon guys, adopting a carnivore diet very, very nicely. And that doesn't work for everybody, but I mean, there's a certain subset of the population that seem to do extremely well with that. And what I find is, because it's a higher protein diet, I mean, for most people, going carnivore is going to increase your protein percentage. And we know that athletes, including endurance athletes, tend to do better with a little bit higher protein. We also know that because you've removed all the garbage from your diet, I mean, a carnivore diet by definition is free of junk food. I mean, you can't literally you can't have junk food on the diet, because there's nothing made from animal products that I would consider truly junk food. And so I think that also leads to decreases in oxidative stress, inflammatory issues. You recover better. For me, I just found that, even though I'm in my mid-50s, I'm about to turn 55 in a couple of weeks, my recovery is solid. I mean, I can train like, Monday I got up in the morning, I did sprints, I did deadlifts, later in the afternoon. Then that evening I went to jiu-jitsu, and it was all done on meat, and I had no problem with any of that stuff, from performance recovery. I woke up the next day and felt totally fine, ready to go do it again. So, and that's a comment I commonly get is, hey, my recovery's through the roof. I don't get sore. My energy is pretty stable. And so there's, certainly, I think carbohydrates in some studies will show higher peak, output, like on, say, a cycloergometer. But the problem with that is, when we look at performance, let's look at a typical mixed martial art fighter. They're going to train maybe 3-4 months in a camp, and that entire time they're training. And if during that training, you know, you're feeling beat up, you know, your inflammation's higher, it's going to limit your overall performance. You know, maybe on day one you do well, but by day three, you're starting to compromise your performance. And so the fact that you can, if you can do a meat-based diet, you can train hard on day one. Maybe you can do 98% of what you could do if you had carbs. And then the next day you can do 98%. And the next day you can do 98%. The next day you can do 98%. But the guy on carbs, he has a one-off performance where he hits 100%, but now he's struggling with everything's inflamed. I'm not recovering as well. So the next subsequent performance might be, you know, 87% and 82%. And then, you know, he has to take a day off, which would mean 0%. And then he can go carb up and then hit another 100% day. But the overall, you know, the overall performance, you know, 3 months, 6 months down the line is maybe compromised relative to somebody else doing it. And it's tough to stick to. I mean, for athletes, you know, seeing an initial decline in performance, which many people do, they just can't handle that. And they're like, look, I'm not willing to go through the 3 or 4 weeks or even 3 or 4 months of decreased performance till I adapt. And it's just not worth it for me. So, but we've got, you know, like, NFL athletes on it now. I mean, we've got, you know, some of the top athletes in the world. You know, Danny Sorensen, who plays for the Chiefs, has been on Carnivore now. He's going on 2 years now. And last year he had his season best effort ever. You know, this season he kind of stuttered in the first half of the season, but now he's on fire again. And you know, I've seen just, you know, I mean, again, it's cool to see the athletes do it. I think this is consistent with, you know, what our, you know, if you want to look at, you know, you're in Switzerland in the middle of Central Europe, this was mammoth hunting territory, you know, 50, 100,000 years ago. And this is what these guys lived on. And they were big, strong athletes based on what we can see on their fossil records. I mean, we look at all the fossil skeletal records. We see all the pre-agricultural skeletons from, you know, 40, 50, you know, 100,000 years ago. And they're big, strong, tall people. There's a population in Central Europe called the Grudetians, who were these enormously strong, powerful. I mean, their average height, you know, 40,000 years ago was 6'2". I mean, if you look across the world today, the tallest people in the world right now are like the Dutch, the Croatians, and their average population is 6'1", which means these guys 40, 50,000 years ago were even taller on average, and probably had a lot of guys that were 6'6", 6'7", you know, 6'8" walking around, and they were big, strong people. And so now we've got a situation where population average health has gone down significantly as far as, you know, what we can see in the skeletal remains. Teeth, dental health has gone poorly. Our jaw structure is not even, you know, our teeth don't even fit in our mouth anymore. And that's why everybody's got to get their wisdom teeth extracted. It used to be wisdom teeth, you know, all those molars would come in because you had a wider, more developed jaw, which led to better breathing ability, you know, just better overall physiologic performance. And then we've lost about 6 inches of stature. Our brain has shrunk by a good 200 cc's compared to what it was 100,000 years ago as a species. So, I mean, you know, I think meat is our baseline diet. And we've kind of gone so far away from that, and that's why we have what we're seeing now. And I just saw statistics showing that 80% of American men are now considered either overweight or obese or morbidly obese. And, you know, some people say, well, that's based on BMI. But honestly, I mean, there's just not that many jacked people walking around. You know, some people say, oh, I got a lot of muscle. But go to the grocery store, see how many ripped jacked dudes you see versus how many fat, sloppy guys you see. Yeah. And it's, you know, I think it's clear. I mean, there's a bunch of overweight people. No doubt about it.
So what blood work do you do to ensure that all the health markers are there, the longevity, inflammation, everything's in check?
Well, I mean, the honest answer is I can't tell what blood markers to do to ensure longevity. I mean, that's still basically, we don't know. I mean, I can't go in there and say I get one lab test or even a combination to say I'm going to live to 100 because my blood is this. First of all, you have to remember that the markers in your blood change like every 10 minutes or every 5 minutes or every day. So they're always changing. So you can't just go in there and say, based on one blood test, I'm doing the right thing or the wrong thing. I mean, there are some trends and general patterns you might want to look at. And so I think things like, you know, I personally like to look at the actual things I'm concerned about. And so if I want to look at, say, what's my kidney function at? There are tests you can do to show that your kidneys are working well. I've done those. I mean, that can be part of a normal basic chemistry panel. But I mean, for people eating a high protein diet that have a lot of muscle mass and are exercising, the creatinine, which is usually used to determine that, it can be skewed. So you might get something like a cystatin C. Inflammatory markers can be useful. If your inflammation is low, that's generally thought to be a good thing. But there's reasons why it would be high and it would be normal. I mean, like I said, if you are, if you have an illness, like if you had say you had a cold and you went in and got your markers low, your inflammatory markers, you might see an elevation of C-reactive protein, which it's explainable. Or even if you exercise, if you go in there and just train your butt off really hard and you go in and check a C-reactive protein the next day, hey, it's going to be more elevated. Same thing with your liver function test. So I look at things, that are kind of more long-term for me. So blood pressure, I think, is a very reliable marker for most people. Again, there's some people situationally, they have quote unquote white coat syndrome. When they see the doctor's office, they get stressed out and raise their blood pressure. But I think blood pressure is a pretty good one. I think waist to height ratio is an excellent measure of things like insulin resistance. If you stand, I'll put it in inches because I deal with that 72, 6 foot tall, you're 72 inches, your waist should be at the belly button, should be under 36 and ideally probably closer to 34 inches. And so that's a general marker there. You can look at blood glucose, you can look at, things like, obviously, a lot of people will talk about the lipid panel. What's your LDL cholesterol, HDL cholesterol, what are your triglycerides? That has some utility, although I think that we're finding that it's a much more nuanced and complicated story than the original high LDL cholesterol, always bad, low LDL cholesterol, always good. I think that dichotomy is really kind of rudimentary thinking. It doesn't seem to hold up in the real world when you look at more nuanced things. I mean, if you want to get into this, then you have to really dive deep in this stuff. But I mean, I think you can get advanced lipid panels. You can look at ApoB, ApoA. You can look at LP(a). You can look at oxidized particles. You can look at glycated particles. You can look at the particle size themselves, whether they're large and supposedly the large fluffy particles or the small dense particles, and each of those has an impact on the atherogenic of those particles or how likely they are to cause cardiovascular disease. But at the end of the day, I'd rather look at the vessels themselves. Like I said, there are studies out there that do that. You can get your neck scan with a carotid intermediate thickness test. It's an ultrasound test, non-invasive. You can get a coronary artery calcium scan like I had done, where it's just an X-ray imaging. It does expose you to radiation, so that's the downside, but it gives you a good look at that. And when I did mine, it was a perfect zero. I mean, it was a perfect zero score, despite having eaten lots of fat and lots of meat over the previous, decade. You can look at, there's a couple new tests. There's a Clearly test that's just come out. It's a CCTA test, which stands for coronary computerized tomography, tomogram angiography, where they inject some iodine contrast dye, and then they look at the blood vessels, and they can use AI algorithms to calculate exactly where and how much risk you have based on that. And so those are all things you can do that I think are more helpful than, like I said, I mean, a lipid panel, if you've got high LDL cholesterol, to me, that's not something you should ignore, but it just means I need to ask more questions. Now, if you're the standard American guy that's eating garbage and you got a big old belly and you're pre-diabetic or hyperinsulinemic and you've got underlying inflammation, your blood pressure's up a little bit, in that situation, yeah, probably that dyslipidemia, that high LDL cholesterol, is going to contribute to cardiovascular disease. And if you just leave that's one risk factor where you can mitigate. You could take a drug to lower it. Somebody might suggest you go on a low fat, high cardboard diet. That's what I call these diets like eating cardboard. And that may have an impact on the situation, but you'd be better served by losing weight, leaning out, dropping your inflammatory markers, improving your glycemic profile, and those things tend to come with not necessarily the low fat diet and statins, but an entire lifestyle overhaul, which in my view includes a decent amount of meat and just getting rid of the refined garbage. And I think that's going to have a bigger impact for more people. And I think that's just something to consider. That's how I look at it. I can't tell you. I mean, there's no way for me to say how long I'm going to live. I'm generally pretty healthy. I think healthy people generally have a higher quality of life. There's no doubt about that. And most people in that situation probably have better longevity, but there's no study I can hang my hat on and say, yes, because, I maintained X amount of strength, or, I was on a certain diet, that I'm going to say I'm going to live longer or shorter, or get cancer or not get cancer, or get heart disease or not get heart disease. Because there's never ever been a study done that can actually really show that. So we're just making these inferences based on population data and what we think people eat, or what they, we do these, these giant, prospective or retrospective looks at what people are eating, and they say, here's a form. Tell me how many blueberries you ate in the last 6 months, or how many cups of ribs you ate. I mean, it's just garbage, and most people don't remember. And if they answer the questions in a way they think is the right answer, and so there's this recall bias, and this sort of bias, basically healthy bias, to where you want to say you're healthier than you are. And so the data is just garbage data. So you garbage data in, and you expect you get some sort of usable data at the outside is just wrong. And so I think it's more important to take people that are sick. If you got somebody who's obese, somebody who's diabetic, somebody who's depressed, and if you fix that, and you can make it so they're no longer obese, no longer diabetic, no longer depressed, that's really as good as you can hope for. I mean, I honestly, I think, if you just do, if our healthcare system would just focus on that and not worry about, hey, we think you're going to have heart disease when you're 72, because we don't know that. I mean, if we just focus on getting people sick and healthy, we'd have a much different healthcare system with different priorities, and we would have, in my view, a much happier population. That's what we're setting out to do with our company, and we're, as we're going into significant funding rounds to help us scale, as we've already demonstrated we can do this on a scale of a few thousand people, but we want to scale that up to where we're talking hundreds of thousands and even millions of people. So that's where I'm coming from.
Now, in regards to organ meats,
Mm-hmm.
what's your take on that? Some guys say eat them. Some guys say, it's not necessary. I know that you're a 4 pounds of steak kind of guy. And I haven't really seen you eat too many organs.
Yeah. I mean, I've had a few over the years, and, I don't like them. I mean, I don't enjoy them. So I don't want to eat food I don't like. I mean, it just makes sense. I mean, I'm not going to enjoy it. If I have to suffer something down, I'm not going to stick to the diet. But, it's the same thing. Like if somebody told me I'd eat broccoli every day, I mean, it's, like raw broccoli in particular is just awful. So here's the data. So there is not a lot of data on carnivore diets and organ meats, but there is some. And some of it I gathered when I did a population survey of 12,000 people. Harvard University, which just published their study on the carnivore diet on 2,000 people, basically showed whether you eat organ meats or not doesn't seem to make a difference to the outcomes, in a general setting. If we look at population averages, it doesn't increase or decrease your likelihood of signs of nutritional deficiencies. It doesn't seem to increase or decrease the likelihood of you being able to get off medications, or notice subjective improvements. So my general recommendation is, if you like it, eat it. If it does provide a tangible benefit for you, then eat it. If it doesn't, don't worry about it, because it doesn't seem to be a necessary thing. I think for some people, and there's some people that'll say, hey, when I eat liver, I feel like Superman. That's great. Go ahead and keep doing it. I mean, I would caution that there are a small number of people that find that they actually have negative side effects from eating it or eating it too much. So I think it's just one of those things where, certainly, there's a lot of cultures where it's been prized, and people try to paint this picture of it's so valuable. These cultures, these indigenous tribes, would eat this stuff. But the way I look at that is most indigenous tribes today, it doesn't matter, you find some small tribe in Central America or South America, or, some of these, northern populations. I mean, one of the reasons, that they sort of eat these foods is because they're hungry and they don't have any other food. I mean, they're literally living on a subsistence situation, and so they're not going to waste anything. But when you put people in a surplus situation, you see a very different pattern emerge. And same thing with animals. When the pickings are slim in the African savanna, the lions are going to eat much higher percentage. The the primary predator is going to eat much higher percentage of whatever animals left. But if they've got plenty of stuff to kill, they'll nibble on a wildebeest, and they may leave 50 kilos of meat behind, including the whole pack, because they're like, yeah, we don't want to eat the real chewy meat around the legs. A lot of times they leave the back haunches and the lower legs. They obviously can't access some of the stuff. They can't get into the skull, and so then the secondary scavengers will come in, the hyenas and vultures and stuff, and they'll pick through some of that. But I mean, it's something that I think one of the things, one of the observations is, well, these animals always go for the viscera first. The first thing they do is tear through the gut. And I think one of the issues is, it's not so much that they're like, ooh, I really want some liver. I think it's really they want some fat. Because if you look at like an antelope, there's no fat on an antelope. I mean, except in the viscera. This is where the omental fat is, the perinephric fat, or the suet, the fat around the heart. And so they're going to go in and get that stuff, because you can't get it anywhere else. Now, wild animals don't quite have the requirement for fat that humans do. It's something that's interesting. Humans have a much higher requirement for fat. And so if you look at feeding studies, like I've got 2 dogs laying next to me, and they're the happiest damn dogs in the world because they get nothing but meat. But I know if I give a dog the same fat percentage that I have, they're going to get sick. And they usually ends up with, they have upset stomachs and they'll have diarrhea. And so what will happen if there's been studies on dog self-feeding. And what they'll do is, a dog that's kind of been somewhat malnourished, when they first are given choice of meat, they'll eat fatty meat to start with. They'll do that for 2 or 3 weeks, but then they'll transition to a much leaner, proportion of meat. And so my dogs, if I give them ground beef, and if I give them something that's like 73-27, lean to fat, they're going to end up with digestive issues. But if I feed them 90-10, that's a sweet spot for those guys. But whereas for me, if that's the only source of fat I have and I'm not eating carbs, I'm going to end up with energy issues. I'm going to end up with hunger problems. And so, humans, like even among primates, we are the fattest primate around. I mean, and the reason is because of our brain size. Our brain requires significant energy, much more energy than say a chimpanzee or a dog or a horse or whatever. And so we have to have a certain amount of fat reserve so that brain can continue to be fed. Yes, some of it is glucose, but the brain also can do well on free fatty acids and ketones. And it also, and by the way, we make glucose. I mean, even though I don't eat carbohydrates as a general, there's literally months and months and months I'll go without having any carbohydrates, and then every once in a while I'll have some cheese, or sometimes I'll do something off the diet, but I mean, I'm making glucose every day, so it's not like I'm devoid of carbohydrates because I make it. I mean, my liver makes plenty of carbohydrates. In fact, when I go out and work out, my blood glucose shoots up pretty high because it's like it's providing what I need. I'm so well adapted to this that I can perform at a high level because my liver knows, hey, it's time to switch on. So I'm going to pump out. I'm going to pump up the hepatic glycogenolysis, where you break down the glycogen in your liver. And in fact, studies show that you can basically increase the amount of glucose your liver puts out by 1,500% just by doing some exercise. And I suspect if you're chronically adapted to doing it that way and not taking exogenous carbs for exercise, it's probably even more. So I might be able to increase my liver output of glucose, maybe as much as 5,000%, I'd guess, something like that. Anyway, that's a long-winded answer. Sorry.
No, you're the one here to talk, man. We're enjoying it. What about like in terms of the quality of meat? I mean, that's one of the things that here in Switzerland they always talk about, how much better the Swiss quality meat is compared to elsewhere. Do you see that has a big difference on people, or is it just meat is still the net positive and it doesn't really matter the source? Yeah,
I mean, I think there are very good reasons to push for sustainable agriculture and environmental reasons, animal welfare reasons. I think those arguments are solid and valid. Unfortunately, the human health argument, there's really not any data to support that in a real systematic way. I mean, there's only been a couple studies. I'm aware of about 3 studies where they looked at, we'll say, organic meat versus the typical feedlot finished meat. One study was done in Australia. The outcomes they looked at was postprandial inflammation, which we don't even know what that means clinically. And they compared cattle on a feed yard versus wild kangaroo, which was, I thought, a weird comparison because they're not even the same species, you know. So, but that was one. Texas A&M University did 2 studies back around, I want to say 2012, where they looked at ground beef. One was grass-fed, grass-finished, and one was finished in the feedlot. And they looked at some biomarkers. They looked at cholesterol markers. They looked at weight, and they looked at, I think, blood pressure. I can't remember the exact things they looked at. But the difference was not statistically different. It was basically the same outcome. In fact, the people that had the grain-finished beef had maybe arguably a better outcome. But it was so minimally different that it doesn't really matter. So, I mean, that's a day. And you know, this is the same thing with the Harvard University study where they looked at these 2,000 people, because I asked the researchers, because I know the researchers and I helped to sort of organize the study for them. And I said, hey, would you please ask people if they're eating grass-finished beef or organic beef? And they did that. And again, they didn't find a significant difference in the outcomes. So, you know, and I know a lot of people give me a lot of grief about that, for saying that how could you dare tell people to eat meat that comes from a feedlot? Well, I'm just saying this is what the results are. I mean, I would like there to be a more of a regenerative agriculture. And I'm constantly supporting that. I'm bringing on regenerative agriculture ranchers and trying to encourage people to buy direct from their ranchers for reasons other than, the health of it. I think there's, for the health of the planet, perhaps, or the health of the industry, because, if we don't support these guys, they're going to be driven out of business, and then we're going to have a complete takeover of our food system by these giant global corporations who, like Beyond Meat, like you have behind you, Mike, and they don't care. They literally do not care if you're healthy, if you live or die. All they care about, well, I guess they want you alive so you can continue to buy their crappy product, but it's not their sort of reason to exist. I mean, it's to make money, and so all of us have to make money, obviously, but I mean, if you don't have the consideration, if you don't even care what the health outcome is, then you just have to accept that. And if people know it, people realize that the Beyond Meat is not here to make you healthier. They're here to make money, and unfortunately, they're not making money; they're losing money, and so hopefully they'll go out of business. Is my hope with those clowns. But because we got the guy Patrick Brown saying he's gonna bankrupt the entire meat industry and get it off the earth, and that's obviously not something I would be supportive of.
Yeah, I love on your Instagram, all you do is shit on the Beyond Burger, the Beyond Meat stocks. Like, all you do is keep posting that. I love it.
Yeah, I mean, it's entertaining, and obviously, social media is goofy. I mean, it's it's entertainment. I mean, I put up scientific studies and I get 3 comments and a few likes, and I put up some stupid, goofy vegan meme and I get 6,000. It's just the way it works. I mean, so you got to play the game to continue to keep people engaged so you can get your message out there. But I mean, honestly, sometimes I have fun with it, because, you get people that are so bought into this stuff, and, they just come across as crazy. And so anytime you can kind of say, hey, wait a minute, this doesn't make sense, it's fun to do.
Yeah. Provoking people is always good for interaction.
True. That is true. Yeah.
So, what do you have planned for yourself in terms of like training, or have you got any more like competitions that you're wanting to do? I mean, you mentioned, what did you say, you're 55?
Yeah, I'll be 55 on January 10th. So about a month from now, I guess we're December 8th. So a month and 2 days. I'm currently pursuing jiu-jitsu. So I want to compete at the highest level I can compete at, hopefully go to the world championships. I'll probably be age class, but I mean, that's going to be my journey for the next probably five years or more. I mean, I think hopefully I'll continue to do this until I get, whatever achievement I can make. I'm right now, I'm at the very beginning stages, which is really fun. It's always fun to be in the beginning stages of a new sport because you obsess about it, you learn, and you're learning so much, and it's such a wonderful thing. I'd set world records on the rowing machine. I'd set national records in weightlifting. I've won world championships in Highland Games, and all these. I've had all these different sports. I've been very successful, and typically for me, I'll do something 5-7 years, get as good as I possibly can. Hopefully, set a world record, win a world championship, And then beyond that, the amount of effort it takes to even make a 1% improvement is enormous. And so at some point it's like, wow, is it really worth it, my time and effort, and it's taken away from my life. And so I've just traditionally said, well, let's go try something new. And it keeps it fresh. It keeps me engaged. It gives you new passion. It's like you said, if you're doing the same thing over and over again after a period of time, it gets old. Honestly, I've been training in the gym for 42 years now. I started lifting weights when I was 13 years of age. I'm never going to stop doing that. That's just kind of the part of the baseline stuff. And so, I continue to try to maintain certain levels of standard. I just have my own standards. If I'm not at those standards, I feel bad. And so I've got these, like for instance, my goal for this year was to deadlift 500 pounds for 10 repetitions, which, I should be able to do. I've had some difficulties this year with moving and not being in a house, not having access to the gym, and then some other things. But hopefully I'll hit it in the next week or two. I think I'm pretty close to that. And so, if not, I'll do it for my birthday, for my 55th birthday. But these types of things I'm going to be doing. But yeah, as far as the sports, I feel like I always have to have some kind of sport. I don't know what I'm going to be doing when I'm 90. It might be, competitive shuffleboard or something. I don't know, but that's just, I guess I get some level of validation through athletic competition, and that's just hardwired in my brain. And maybe it's a mental illness, but anyway, I think it has at least some good side effects.
So you just brought it up, what I was going to talk about, your brain. You're sharp, like that. You're on point with everything. You remembered where both Brooker and I were from. You remembered our names. You remembered the name of the podcast. You're pretty with it. Did the carnivore diet improve cognitive function, or have you always been this sharp?
I got through medical school with top of my class. I've always had a good memory. I've always had a pretty good lifestyle. I've always exercised. So I think, I've noticed, probably, I can't say I've gotten cognitively better. There's people out there that think I'm stupid as can be, based on what I promote. But I think that, there are times where I can feel like I have less fatigue. And when I'm not fatigued, I can think better. When you're tired, you just want to veg out. That is very infrequent for me now. And that was something that I think I was starting to see more of, prior to this carnivore diet, probably in my early to mid 40s, when I was, I most likely had sleep apnea. And so that's going to cause, daytime fatigue. And I wasn't eating a junk food diet, but I was eating the wrong diet, I've always been a big guy, and I can still do this. I can literally go to a restaurant and polish off 3 entrees and 2 appetizers. And I would do that. I can remember doing that. I go to a restaurant and order three dinners, and then people look at me, that's a lot of food. I know. 280 pounds, I'm a big guy, and I'm burning a lot of calories, but these days, I think pretty much, some of this is stuff like I said, I've thought about this stuff over and over, and some of it's reflexive to talk about, but, I still try to maintain mental sharpness. It's just kind of like, even just doing stupid math stuff in your head. It's just like, just kind of maintain those basic cognitive skills. But I think, the brain is an organ just like anything else, and it wears out. And, if you've got heart disease, if you've got, liver fat, your brain's going to be compromised. So I think just by maintaining your overall health, your brain's going to work better. It's a pretty, I don't think it's a difficult concept to see. And it's the same thing we see with mental health, for instance. This is an interesting thing because mental health has this sort of weird stigma around it that you can't talk about. Mental health is all about, circumstance and trauma, and, you can't say it's physiology, or God forbid you say that nutrition has a role in mental health, which it clearly does. Why would nutrition affect you and cause heart disease, but not cause brain dysfunction or brain disease? And it clearly does. And one of the really cool things I see about, dealing with people doing these diets, and literally I literally have a meeting every single day of my life with a large community of people, and I constantly get a feedback that I'm now happy. My depression is gone, my anxiety is gone, my bipolar is gone, my PTSD is gone or better. So we know unequivocally that diet impacts this, and I think it's such a, and I think secondarily we could probably just say, probably it impacts cognition. It probably is going to, I mean, clearly, if you guys don't know it already, we're going to have an epidemic of dementia coming up. I mean, you know, all these giant overweight people that are diabetic, a significant portion of those people are going to become demented, and it's going to happen at earlier and early ages. And so instead of, you know, grandma in their 80s, it's kind of goofy and you laugh at her because she's forgetful, which is what, you know, we would think, oh, it's just old timers disease, you know. Now you're going to start seeing that in 50-year-olds, and you're going to have 50-year-olds that, 50-year-olds that can't function. And what's going to happen to them? Well, their kids are going to have to take the brunt of that. So you're going to have mom and dad moving into your house when you're a 22-year-old or 25-year-old trying to, you know, raise your own family or start your career. And now you got demented mom or demented dad, you know, occupying time, or you spend $50,000 a year to put them in a home, which is what the average cost is for this stuff. So something that's coming, it's a looming crisis. And I think, you know, everything I see is not making it look better. I mean, this statistic that now 80% of the males in the United States are either overweight or obese, you know, granted, that's based on BMI, which has its limitations, but again, the majority of the people that's the accurate for. You know, there's a few guys that are walking around ripped and jacked, but that ain't the majority, as we all know.
Yeah. Type 3 diabetes, Alzheimer's, right?
Yeah, there's people that call that. I mean, there's Dale Bredesen out of UCSF, you know, has got some research on that. I mean, Amy Berger, who's you know, she's kind of a layman. I mean, she's a nutritionist. She's wrote a pretty good book and done a lot of research, and I think she's done a lot of good homework on that. But yeah, it seems to be at least part of the pathophysiology of some of these dementia problems is brain energy handling. You know, it's brain insulin resistance, not being able to handle, you know, process and absorb glucose. And so the brain's like, hey, I got no energy, so then I can't think. And, you know, we see that with a lot of people that have Alzheimer's disease or as they get dementia, all they want is cakes and cookies and sugars and ice creams. That's all they want to eat because that's what they need to eat enough of it to overcome that resistance. And I know there's some people that point out that our commander-in-chief is constantly looking for ice cream, and he has candy stashed all over the White House. And, you know, there's some concerns about his mental faculties. But I mean, it could be he's in the early stages of, you know, developing dementia. It wouldn't be surprising given his age and some of his, you know, seemingly cognitive issues he has, but it's interesting to see. But yeah, that's coming. That's going to be a huge issue, and I think people are just, maybe they're not aware of it. I mean, certainly we're seeing it for sure.
Are we up on time?
No. We're oh yeah, Doc. Do you have more time?
Yeah, let's go. We can knock out let's say another 15 minutes, I think, and then I've got to run. So
cool. What are some do's and don'ts for people that want to do this carnivore diet?
Well, I think, you know, don't, you know, go in there thinking that I'm gonna have to eat plain ground beef for the rest of my life. I mean, I think, you know, you should enjoy it. I mean, make food you like, take some variety. I think transitioning, I think some people jumping right into it and saying, okay, I'm going from a diet where I'm eating 600 grams of carbohydrate a day and 60 grams of fiber and all kinds of sugar, and going from that strictly into tomorrow I'm going to eat nothing but steak and eggs, can be a shock to the system. And you know, the other thing is if you're on, and so the transition could be particularly problematic and hard. The other thing is if you're on medications, you know, particularly diabetic meds, hypertension meds, some pain meds, some psychiatric meds, or mental health medicines, you'd probably do well to get someone in your healthcare provider involved fairly early, because particularly with diabetic meds, you might find that, like say if you're on an insulin regimen or a sulfonylurea medication, and you suddenly drop all the carbs out of that, you may end up with precipitating a huge hypoglycemic crisis, which can cause a seizure, can cause you to pass out. It could even, in some cases, you could potentially die from something like that. So, if you're on those meds, you need to definitely, you know, have somebody that can monitor you and potentially deprescribe those or lower the dosage. I think not eating enough is a big one. A lot of people go in there and they'll eat like 12 ounces of steak and 3 eggs. And they're like, oh my God, I'm so full. I'm not used to the satiation. And they may not eat the rest of the day, and they're just not hungry. And that's fine. I mean, it helps you lose weight, but you have to be mindful of the fact that, you know, you got to get energy from somewhere. And so some people find that they're like, well, I'm just tired. I got no energy. I can't perform, you know, that type of stuff. And so you have to make sure you're eating enough. I think, you know, overly obsessing about macronutrients, overly obsessing about calories in the beginning, particularly, is just it's going to make it very difficult and challenging. I think for most people, and again, this may not speak to everybody, but most people I encounter, the reason they're trying this diet is because they've struggled with health. Most people are dealing with obesity or overweight problems. And the reason they got there is because, honestly, they just can't stop eating the crap food. I mean, they're whatever. There's triggers, there's cultural reasons, there's emotional reasons people eat. It's kind of, you can call that food addiction. Some people don't like that term, but I think it's pretty accurate. And so I find that if you try to restrict and say, okay, I got to lose these 50 pounds, and tomorrow I'm going to go on a 1,200 calorie restricted carnivore diet, or 1,600 calories, or whatever it is, what's going to happen is you're going to get 2 or 3 days into it, and all of a sudden you're going to have these massive cravings. You're going to be hungry, and you're just going to say, screw it, it's not worth it. And you're going to go and eat, the 6 pints of Ben and Jerry's that's in the fridge. So rather than do that, I say, eat to your full. Eat to full satiety. If you're hungry, eat again. Don't worry about gaining or losing weight. Just sit there and go with the flow. Let your body transition over to this sort of style of eating. And then, once you're kind of like, hey, I can take or leave the chocolate cake. I don't care. Even if I'm hungry, I can take it or leave it. And that may take 2 or 3 months to get to that point. Then you can start saying, okay, now do I need to? Can I adjust things up? Can I change my eating window, my eating frequency, my how much protein I'm eating relative to fat? And then those things come in, because you're in a much better physiologically and psychological place to do that. So I think those are some of the things I see. I mean, like you said, organ meats are fine. Fish is fine. Pork is fine. Eggs are fine. Dairy is one of those things where I think it can be fine for a lot of people. Some people obviously don't tolerate dairy at all, or they're lactose intolerant. I think some of the problems is sometimes with these concentrated fats, like, heavy cream is very tempting, particularly if you say, I'm going to mix that with a little bit of sweetener. I'm going to throw some stevia or monk fruit or erythritol in my heavy cream. And now something that I would have only eaten, maybe a small portion becomes this giant portion. It's very easy to drink calories. I think drinking calories is a mistake for most people, particularly if your goal is to lose weight. If you're trying to gain weight, that's a different thing. That's all the protein shakes and the gallons of milk that people try to drink. But if you're losing weight, drinking calories is generally a mistake. So dairy falls in that category. I know people are talking about, what about raw milk and all this stuff? And, again, I think with dairy, there's a lot of nuance there. Some people do better with different types of dairy. Some people do fine with butter, but not with milk. Some people do fine with A2 milk, but not A1 milk. And so you've got all these things to be cognizant about. But I generally say for the beginning, if a slice of cheese put on a hamburger bun, or not a hamburger bun, on a hamburger patty, makes it more palatable to you, and so that you can stick with it. The same thing with seasonings. It's the seasonings and spices in the beginning. If the thought of eating dry, plain ground beef doesn't excite you, and it doesn't excite me, then throw some damn taco seasoning in there. Throw a bit of shredded cheese on there in the beginning to get you to kind of do this thing, so it doesn't sound like a dreadful prison sentence. And then eventually your taste will change. And you might find like if you're dealing with Crohn's disease, you might find that spices are really a problem for you. So you have to monitor that stuff. But for the average person, say they just want to lose 20 pounds or think about doing this, make it as palatable and as enjoyable as possible. And then you can always tighten things up as you go, and you can see, just the act of getting rid of the garbage, the beyond garbage food out of your diet is going to have such a huge impact on you. And I think eating plenty of nutrient dense animal foods, eggs, meat, cheese, organ meats, if you like it, seafood, is going to be so fulfilling, because we look at, why we eat, what's driving our hunger, just from a physiologic hunger standpoint. I'm not talking about emotional eating or eating out of boredom, but I'm talking about when I'm actually hungry, what is my body asking for? What's asking for? It's asking for energy, it's asking for protein, it's asking for fat, it's asking for vitamins and minerals and other, nutrients. And if I'm not giving that, I'm going to continue to be hungry. So if I decide that I'm really hungry, I'm going to eat a bag of potato chips. I'm going to eat that forever. I'm going to eat the whole bag, and then I'm still going to be hungry. Then I'm going to be in the fridge looking for ice cream. So if you give your body high quality nutrient-dense food from the get-go, it's much easier to satisfy that appetite. And then all of a sudden you're like, okay, well, I'm not that hungry anymore, and I can go 6 to 8 hours without needing to eat again. And a lot of people find that they naturally they naturally just don't want to eat that much, and that's fine. Again, the caveat being just don't undereat to the point where you're tired and lacking, the ability to do things.
What about processed meats like bacon or like prosciutto or super sod? How you doing? Anything like that?
Well, I think it depends on, what it's processed with. There's some that it's more egregious than others. If something's got, a few ingredients, it's not a big deal and it's a tiny percentage. Like I say, we see sugar, bacon cured in sugar, and I'm looking at it, it's a tiny, tiny percentage. Now, for some people, it might set them off and they might have issues, but for the vast majority of the people, it's probably not a big deal. I think that's something that, but if your breakfast sausage is 20% wheat protein or, vegetable protein and soy and 10 grams of sugar on the label and all the crap in there, then that's probably something you do best to avoid. Processing doesn't inherently make something bad. Technically cutting a steak off of a subprimal is considered processing it. Grinding beef is considered processing it. So processed food is ultra processed junk food. It's kind of like pornography. That people said, I can't describe it, but I know it when I see it. And we all know that if you go to the grocery store and you got a pack of Oreos, that's something I don't need to eat. And the same thing with all these, these products that are keto friendly or paleo friendly, and they're just cookies. It's still a goddamn cookie. You shouldn't be eating that stuff as your primary, it shouldn't be your main source of food. And some people do it. They think that, just because it has a plant-based, like the thing behind you, it's got a made with plants, it's somehow a health food. Well, it's not. It's just all that means is it's cheap and profitable, and you're a sucker. Whenever I see powered by plants or made with plants, or I just think cheap, highly profitable, and you're stupid. That's what the label says to me. Like I said, your food shouldn't need a label, right? You shouldn't need it. Ideally, if you don't have an ingredients list, you're probably doing pretty well for most things.
You probably get, I don't even want to know, hundreds of messages a day from different people saying how much, your knowledge has helped them out with the carnivore diet and different stuff like that. What's one thing that you never would have guessed would be improved with this approach?
And this is something, I've been doing this long enough where nothing surprises me anymore. But early on, it wasn't surprising to me to see like diabetes and obesity go away. Those are pretty cool things. And then, then we started seeing these autoimmune conditions improve, which are really, really hard to improve. That was really cool. And I thought that was cool. The weirdest thing I think I started seeing were some of these genetic diseases. So we had, I remember I've had it several now. There's a condition called Ehlers-Danlos syndrome, which it is literally a genetic condition which results in problems with collagen production. And people end up with their skin is real super stretchy. You see these people that can like stretch their skin out like that, and they tend to have really hypermobile joints. And as time goes by, they keep dislocating their joints. Their shoulder will pop out of the place, their ankle will dislocate, their knee will dislocate, their fingers will dislocate all the time. And I had an emergency room physician who was 57 years of age. And literally, she would wake up every morning in her sleep. She'd wake up and just from tossing and turning in her sleep, she'd dislocate shoulders and ankles, and she'd have to wake up every morning and put 2 or 3 of her joints back in place. And then she would go to work as an ER physician, and probably every other ER shift, she'd have something pop out of socket. So she'd like, hey, a minute, hang on, guys, hang on to the emergency. I got to go put my shoulder back in place. And this was her life. And because of her joints were constantly popping in and out of place, she was developing arthritis, which would be no surprise. Every time this thing comes out, it's traumatic because she had quite a bit of arthritis, and it was painful. And she was gaining weight because she couldn't exercise, and it was something that was really. And she literally went on a carnivore diet, and within 1 month, pain went away. No more joint dislocations. They just stopped dislocating a month into the diet, and she'd gone. Now she's been something like 2 or 3 years without a joint dislocation. So that's a genetic disease that had affected her entire life. And I'm still trying to figure out how that works, physiologically. I've got some hypothesis on this, but it's just kind of like, it even seems to affect genetic disorders. So it means that probably a lot of these genetic disorders that we see, perhaps the environment provides a condition so that they can actually manifest themselves. And if you put them in a different setting, they're maybe not problematic, and perhaps it might even confer an advantage. If you guys probably know sickle cell anemia. Sickle cell anemia, is something that affects a lot of Africans, and it can cause problems, and people die from that depending on how if you have a recessive versus a dominant gene on that. But many people don't know that sickle cell anemia actually protects you from malaria. So there was a reason for that genetic mutation to occur that was actually conferred an advantage. So low-grade sickle cell anemia protects people from malaria, but when it becomes fully dominant, then you start having some of the problems. So again, it depends on your environment. If these people had not lived in Africa where malaria was endemic, there would be no pressure for that trait to evolve. And so it's kind of one of these things that these genetic things are kind of a bit of a mystery.
Fantastic.
I have one more question, and then we'll let you go. Hormesis, right? There's a certain amount of hormesis that occurs when you incur when you, I don't know, do something stressful, whether it's a sauna or you take an ice tub, or let's say eat vegetables, right? So Dr. Gundry in The Plant Paradox, have you ever read that book?
I've read it. I haven't read the whole thing. I've looked at excerpts from it, but not the whole thing. But I'm pretty familiar with a lot of what his thought is. Yeah.
Yeah. Long story short, plants can poison you, right? So a little bit of poison can go a long way for hormetic stress.
Right.
What are your thoughts on that? Do you think that's a benefit? It goes back to my thought process of, well, should I have been eating walnuts a little bit the entire time? That way, when I have a quarter of a cup or half a cup of walnuts, I'm not taken down and out by this. Like, there's a certain amount of stress, right? Inoculation that's valuable. What are your thoughts?
Yeah, well, I mean, I think, when we look at hormesis in general, and that's the point. A little bit of stress is going to make us more resilient. So exercise. When I go and weightlift, it's hormetic. When I go out and walk in the freezing cold, it's, there's hormesis going on. So there's lots of ways to stress your body to make it stronger. You don't have to do all or any of them. I mean, well, you should probably do some of them, but it's like, is it better for me to sit in the sauna or to load up on broccoli? And then the question is that stress have a net negative? Like I said, if squatting is beneficial to me and it makes my quadriceps and my gluteal muscles grow, that's great. But if I put 500 pounds on my back and I walk out and I trip and fall and crush myself, that hormetic stress has been a net negative. And so you have to say, what is the problem? So for some people, and I'm not going to say it's all people, but for some people, the sulforaphane that's in broccoli, which upregulates some of these hormetic factors. There's other effects that are occurring that are a net negative. And for those people, maybe it's digestive issues. Some people, particularly people with IBS or IBD, inflammatory bowel disease, or the propensity to do that, the broccoli may cause such digestive trauma that it's not worth it. Any hormetic benefit that it gives you is counterbalanced by tenfold worse negative outcomes. So I think it's something that you have to kind of do the risk benefits. And so I think there's the general body stress that's occurring, that's there. But like to your point about the walnuts, if I'm constantly, like, if I work out, I get calluses on my hand, right? And why does that happen? It doesn't happen on day one, but it happens after I continue to do this, and my body is developing a defense system from a lot of knurling on the bar. If I stopped lifting for 6 months, which I'd never do, but if I did, my hands would become baby smooth, and then if I go in to lift, it would hurt. I'd have pain with that, particularly if I'm trying to lift something heavy on a bar. It's got a lot of knurling. So the same thing's happening with your GI tract. If you're constantly exposing it to a low-level irritant, we're going to make a thicker mucus layer. We're going to have things that mitigate that. But if we're not exposed to that, again, say we're just eating meat and everything's like well digested and nothing's an irritant, then that layer of protection is going to say, well, why am I spending the money on that? It's like, if you live in a high crime zone, it may make sense to put up a big fence and, put some security. But if you live out near the middle of Montana, 50 miles from your nearest neighbor, does it make sense to put up, concrete walls? No, it doesn't. So, I mean, it's the same thing. Your body's, it's not worth the expense. I mean, everything we do costs energy, and our body is pretty good at, doling out where the energy needs to go. Like, for instance, our stomach is incredibly acidic. That hydrochloric acid that pH of 1.5 or 1.0, among the highest in the world of all species, is very energetically expensive. And so we wouldn't make that just for the hell of it. It's like, well, let's just go waste some energy. No, it's there for a reason. And that reason is basically to break down meat. I mean, that's why we have that. That's why we have that's why our GI system is made like it is. We have a very acidic stomach and a very involved small intestine to absorb all the food that comes from the protein and fat. So,
all right,
anyway,
we've kept you on long enough, Doctor. Thank you so much. We really appreciate this. This was awesome.
Thank you.
Well, it's my pleasure, guys. Anything to kind of share this, and thanks for having me on and exposing me to your audience. Let me know if there's something I can do for you guys in the future. And I look forward to hearing this when it comes out. So take care, guys.
Thank you, Doc.
Cheers, buddy.